Hello students, today let's discuss a very important concept from the topic Developmental Dysplasia of Hip. One important fact to know in Developmental Dysplasia of Hip is that in DDH, the left hip is more commonly affected than the right hip. Now, as a curious mind, you'll just not want to memorize the fact that the left hip is more commonly affected. You'll also want to know why the left hip is more commonly affected than the right hip in DDH. Now, to understand this concept, you will have to know the most common intrauterine position that is seen during pregnancy. So, let's ask our OBG mentor, Dr. Sonal, about this.
Hi students, the most common fetal position when the baby is in the cephalic position is LOA, that is left occipito-anterior, and that is also known as the second fetal position.
Right. So as Dr. Sonal said, the left occipito-anterior position is the most common intrauterine position that is seen. So now imagine a child being in this left occipito-anterior position. You will notice that the left hip is pressing against the maternal sacrum in these conditions, and because of this pressure exerted on the left hip, it puts the hip at a greater risk of dysplasia and a greater risk of dislocations. And also add to it other factors like if it is a firstborn child, or if there is a condition called as oligohydramnios, or also in first term hyperthyroidism. In all of this, it creates an intrauterine crowding effect which will further increase chances of developmental dysplasia of the hip.
Very rightly said Dr. Shetty, DDH is more common on the left side because of the LOA position, because the baby loves to be in the LOA position. Right? Now, when the baby is in a breech position, when it's a frank breech with extended knees, then also it becomes prone for DDH.